If you're anything like me, you receive consistent and repetitive unwanted phone calls about your car's extended warranty, usually on a daily basis. In my experience, answering the phone is kind of frustrating. No one's there. It's only a recording of a voice long gone. In addition, my car's warranty still isn't extended. Let's shift gears here for a second. I'll let you in on a little bit of a secret of mine. Often I feel badgered from telemarketers even when they're not calling. You might be asking yourself, how is that possible? But I'm here to tell you that I'm speaking in metaphor, and that those telemarketers are actually unwanted and repetitive thoughts. Does that sound familiar to you? Do you struggle with controlling your thoughts? Are they consistent, repetitive, or unwanted? Would you like help with this in a cost-effective or collaborative setting? Well, if you answered yes to any of these questions, I might be able to help you get back in gear. My name is Taylor Mars, and I work with the Cognition Ignition Counseling Center. Here, we specialize in cognitive behavioral therapy. So come on in, and together we can end the extended warranty on those unwanted thoughts. As mentioned before, cognitive behavioral therapy, or CBT, is a therapeutic modality which assumes that what we believe influences how we act and feel. CBT originated from a long tradition beginning with behavioral therapy in the 60s. The main drivers behind the wheel of CBT are Aaron Beck, Christine Podesky, Donald Meichenbaum, and Albert Ellis. CBT assumes that beliefs, behaviors, and emotions, and physical reactions are all linked. In short, changes in one area lead to changes in another. CBT effectively merges cognitive therapy and behavioral therapy techniques. Basically, it all comes down to the idea that we struggle not because of the events that we go through themselves, but how we end up viewing them. CBT is collaborative. As your therapist, I'll seek to understand the way that you understand the world. We'll go through this educational process together, in which constructive thinking and new cognitive strategies are learned and practiced. We want to help you understand and order your thoughts, feelings, life events, and behavior so that you can walk in lasting joy and freedom. In terms of techniques, my first goal will be to attune myself to you and detect ways that you might be incorporating irrational thoughts and absolutes in your life. Once this is done, we'll look at ways that logical thinking might be distorting your emotional health and dispute the core irrational thinking. We call this method the ABCD framework. From here, we'll learn new ways to substitute rational beliefs and healthy behaviors for those irrational ones. As a client, there are a few CBT techniques that you can expect to see in your sessions. Learning to manage and correct negative self-talk is one of our primary techniques. If we engage in positive self-talk, we're much more likely to remain motivated to reach our goals. A secondary technique is reframing events and harmful perspectives. This will help improve our relationships with self and others. We'll do this by understanding your worldview and helping to bridge over to a new way of thinking. Next, we'll reinforce this perspective to make sure cognitive change happens. Finally, a last technique that we might work with will be conditioning you to react and handle different thoughts and events through exposure. This will happen by perceiving the threat intellectually or in real life if this is possible, appropriate to your treatment, and safe. This process is called systematic desensitization. CBT is a valuable treatment for mild, moderate, and severe forms of depression in adults and adolescents. At the University of Nebraska, a 2007 study of the effectiveness of CBT with adolescents suffering with depression evidenced a massive decrease in suicidal ideation and steadily increasing rates of response from 41 to 81% of clients over a 36-week time period. A 2020 article from the Journal of the American Medical Association states in their cognitive behavioral therapy meta-analysis that clients present significantly lower anxiety symptoms within 12 months after treatment completion. Relapse rates after treatment were 0 to 14% of clients across 69 random trials with 4,118 patients. So, if gaining insight, clarity, and peace of mind sound like things that you could use more of under the hood of your life, then CBT and its associated practices might be a right fit for you. Here at the Cognition Ignition Counseling Center, we'll work with you to create effective and realistic therapeutic goals to help steer you into greater health and well-being. So come on and grow with us, celebrating just how great life can be.